Good morning. My name is Alana Tejada and I'm gonna be reading Unit 5 to 13 from the Professional English in Use. So let's start. Write sentence to describe the work of the specialist in each branch of medicine. Like it be opposite to help you. Dermatology. A dermatologist is specialized in diseases of the skin. Rheumatology. A rheumatologist is specialized in diseases of the joints. Traumatology. A traumatologist is specialized in accident and emergency medicine. Pediatrics. A pediatrician is specialized in diseases affecting children. Obstetrics. A obstetrician is specialized in managing pregnancy. Complete the table with words A, B, and C opposite in related forms. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. So we get as a verb specialize, as a noun person, specialist, and as a noun activity or theme, and specialization. So we got practice, practitioner, practice, consultant, consultant, consultation, assist, assistant, assistance, graduate, graduate, graduation, qualify, qualification. Find prepositions in C opposite that can be used to make word combinations with the words in the box. Then use the correct forms of the words to complete the sentence. A pathologist is specialized in diagnosing disease through examining cells and tissue. A pediatrician must enjoy working with children. An oncologist is specialized in the diagnosis and treatment of cancer. A psychiatrician must be good at counseling. A neurosurgeon must be good with her hands. Making word combinations using a word from each box. Two words can be used twice, like an A, B, and C opposite to help you. We got consulting rooms, general practitioner, group practice, health center, internal medicine, surgical specialties. Unit 6. Make word combinations using a word from each box, like an A, B, and C opposite to help you. So the combinations that I did was associate specialist, house officer, on call, professional diagnosis, radio pager, word round. Match the descriptions 1 to 5 with the job titles A to E, like it A and B opposite to help you. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. Consultant. Dr. Stewart has just started the second year of her foundation program as HO. Dr. Syed has started his training as a surgeon, specialist registrar. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. House officer. Dr. Miller is in charge of the medical staff in the Birmingham Hospital, medical director. And the following states true or false. Find reasons for your answers in A, B, and C opposite. A medical graduate becomes registered 2 years after graduation. False. The system of training doctors in Britain is called the Foundation Program. True. The name of senior house officer is no longer used in Britain. False. The consultant is usually the first doctor to see new patients. False. When working in shifts, all doctors take turns to be on call. True. Complete the text of a PRHO describing her job. Look at A, B, and C opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there's have been any new patients. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or to take down. Later in the morning, I clerks any new patient, which basically involves taking a history. On Thursday and Friday morning, the consultant does her ward rounds, and I have to make sure I'm complete up to date on her patients. After that, there are usually lots of things to do, like writing up requests from blood tests and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They're usually happy to be going home. And then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday. Unit 7. Complete the sentence. Look at A, B, and C opposite to help you. Someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurses is a clinical support worker. Someone who is not qualified but is able to assist nurses is a nursing auxiliary. A nurse who is qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. A nurse who looks after a ward is a church nurse. A nurse who works in the community is a district nurse. Someone who answers the ward telephone is a work clerk. Make word combination using a word or phrase from each box. Look at D opposite to help you. Carry out a procedure. Change a dressing. Check the temperature. Give an injection. Remove suture. Complete the sentence with the correct grammatically form of perform. An isotope brain scan is painless and easy to perform. Biopsy of the pancreas was performed last March. If the patient's condition deteriorates, a laparotomy should be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year, we performed a randomized double-blind group study. Complete the sentence with the correct grammatically form of carry out. I now intend to carry out a large study. Unfortunately, few properly controlled trials have been carried out so far. A number of studies have been carried out recently to look at this question. A right hemicolectomy was carried out and the patient made a full recovery. This procedure can be carried out in the emergency department. Unit 8. Make word combinations using a word from each box. Look at A, B, C, and D opposite to help you. So the combinations are ambulance technician, artificial limb, club foot, contact lens, health professional, intraocular pressure, occupational therapist, social worker. Which allied health professional could best help the following people? Look at A, B, C, and D opposite to help you. A young unmarried woman who has just had a baby, social worker. A woman who is having difficulty using her right arm following a fracture, therapist, orthosis. Someone who needs glasses, opticians. An elderly woman who has had a below knee amputation, prosthetics, and orthotist. A man whose wife has Alzheimer's disease, occupational therapist. A man with a fungal infection on his feet, pediatrics. Complete the test. Look at A and C opposite to help you. A prosthetics works with patients of all ages as a member of a clinical team based in a large amputee hospital. The patients may need a prosthetics as a regular of an accident or amputation following a disease such as diabetes. Alternative, they have been born without a limb. Orthosists work alongside doctors, nurses, psychotherapists, and occupational therapists to give the people under their care the best possible rehabilitation. Their main aim is to enable the patient to lead a normal life to work and leisure. An orthotist often works in a clinic as part of an occupational service and also visits other centers to provide a service from people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require rehabilitation to help them walk, and many older people need special shoes to correct deformity. If damaged, any part of the human skeleton may require some form of orthosis. The orthosis may be needed to reposition the body or to relieve pain. Complete the table with words from A, B, and C opposite. Put a stress mark in front of the straight syllable in each word. The first one has been done for you. So we got as a verb admit, as a noun admission. Assess, assessment. Discharge, discharge. Operate, operation. Refer, reference. Treat, treatment. Make word combinations using a word from each box. Look at C opposite to help you. Acutely ill, assessment in it. On duty, referral letter, waiting list. Which hospital department would be most appropriate from the following patients? Look A, B, and C opposite to help you. A woman in diabetic coma, intense core unit. A patient who has just had a radical prostatectomy, surgical high dependency. A patient who is to have a skin lesion removed. Day surgery unit. A man with a foreign body in his eye. Accident and emergency department. A woman with a trinate abortion, maternity emergency. Complete the extract from an information left for patient. Like A, B, and C opposite to help you. When you arrive at the hospital, please tell the receptionist who will welcome you. Check your details and direct you to the waiting area. The length of your visit will depend on the treatment you are going to have. You might need to have some tests, such as an X-ray, which could mean going to another department. Or you might be referred to another professionals, such as psychotherapist or dietitian. You might need to revisit the clinic. If staff at the clinic want to see you again, another appointment will be arrangement for you. If you need to be admitted to hospital for more treatment, either as an inpatient or for day surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP's care. 10. Complete the sentence. Look at A opposite to help you. Children over 60s and people with some chronic diseases do not have to pay health care in the UK. Patients with mobility problems may be unable to go out. They are housebound. The average GP appointment is 10 minutes long. A locum is someone who takes the place of a staff member who is on leave. Care outside working hours is known as home visit request treatment. Make word combinations using a word or phrase from each box. One word can be used twice, like an A and B opposite to help you. So we got change dressings, make appointments, perform minor surgery, refer patient, run a clinic, supervise staff, take messages. Which member of a practice team will be responsible for each of the following? Like an A, B opposite to help you. Running a clinic for pregnancy women, midwife. Teaching a patient how to straighten his broken leg, psychotherapist. Letting the GP know that a patient can come to her appointment, receptionist. Running a clinic for people who want to lose weight, practice nurse. Visiting a patient who has just returned home after an hernia operation, district nurse. Carrying out checkups on children in a poor neighborhood, health visitor. Organizing cover from an absent doctor, practice manager. Complete the diary for Dr. Stewart afternoon. Look at A and C opposite to help you. 1 to 2 p.m. Practice team meeting over sandwich lunch. 2 to 4 p.m. afternoon reception, 10-minute prescription. 4 to 4:20 p.m. coffee break. 4:20 to 5 p.m. Check with reception for messages. Deal with home visit and request prescription request. 5 to 6 p.m. Paperwork, referrals to secondary care, admin task, telephone calls to patients, private medical examinations. 6 p.m. Phone switch to OOH service. Unit 11. Match these activities to the stage of medical education in the UK given in A opposite. Dissecting cadavers. Undergrad education. Keeping a log of surgical procedures observed and performed. Postgraduate education. Working for 4 months in accident and emergency to experience this specialty. Foundation program. Taking a 4-week attachment in obstetrics and gynecology. Undergrad education. Taking an online course on recent developments in cardiovascular disease. Continuing professional development. Complete the sentence. Look at B and C opposite to help you. Just before their final year, students have the chance to take an overseas elective in a hospital of their choice anywhere in the world. Problem-based learning contrasts with an approach where each subject is taught separately. These days, seminars are often interactive with regular opportunities for the students to ask questions. In clinical attachments, students learn how to treat and manage patients. Student select models can be a topic from outside medicine, such as forgive language. Dissections of cadavers is an important part of the anatomy component. The foundation program at the University of Edinburgh is one of the oldest in the UK. She is a consultant at the Royal, one of the leading pediatric heart specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have a PBL each week where we discuss topics in a small group hour lecture. Match each of these activities to one of the components of the undergrad course described in B and C opposite. Julia spends 6 weeks working in a small hospital in the Himalayas, overseas elective. A group of students discuss together the possible reasons for abdominal pain after meals in an obese 44-year-old male. Problem-based learning. A small group of students trace the pulmonary artery in a cadaver dissection. Otto spends a month working in the pediatric ward of the local hospital clinic attachment. Annie learns how to take blood from an elderly patient. Clinical skills. Juma chooses to study travel medicine in his 4th year. Student select models. Unit 12. Complete the phrases with verbs from the box. 2 phrases can be completed in 2 different ways. Look at A and B opposite to help you. 1. Demonstrate a competence or how to do something. 2. Supervise a trainee by ensuring she successfully completes her training. 3. Provide a course of training program as a teacher. 4. Take a course of or a training program as a student. 5. Assess progress or competence. Match the 2 parts of the sentences. Look at A, B, and C opposite to help you. 1. An FI1 is a doctor in the 1st year of the foundation program. A demonstrator is an anatomy teacher who teaches dissection. A clinical trainee is a consultant who provides training during periods of direct clinical care. A supervisor is a consultant responsible for the training program of a trainee. A medical school is part of a university responsible for medical education. A placement is a period spent as a trainee in a hospital or in the general practice. A fellow is a specialist who has reached the highest level in their specialty. Write in full the qualifications of the doctors and surgeons. Look at C opposite to help you. MR A H John husband. MBCHB FRCS FRCSY. Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of England. DR.C. Dolly. B. Med. Side. DM. MRCP. Bachelor of Medicine Science, Doctor of Medicine, Member of the Royal College of Physics, or Member of the Royal College Surgeon. MS English, MBBS FRSC. Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons of England. Dear E. Meriwether, BM, MD, FRCP, Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of Surgeons of England. Unit 13. What kind of registration might these doctors obtain? Look at A opposite to help you. A newly qualified Spanish doctor, provisional registration. A newly qualified Nigerian doctor, limited registration. A doctor who has successfully completed the first foundation year, full registration. An SHO who has successfully completed the foundation program and gained a certificate of completion of training after several specialist registrar posts, a specialist registration. Write the abbreviation in words. Look at A, B, and C opposite to help you. Any doctor who wants to work in the UK must register with the GMC, General Medicine Council. Some overseas doctors must pass the PLAB test before they can register. Professional and Linguistic Assessments Board. Part 2 of the test consists of an OSCE, Objective Structured Clinical Examination. In any emergency, remember the ABC protocol, airways, breathing, circulation. Before you can obtain specialist registration, you must have a CCT, Certificate of Completion of Training. Complete the test. Look at A, B, and C opposite to help you. My name's Musa and I come from Yemen. I came to the UK about 2 years ago after graduating. Because Yemen is outside the EEA, I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at consulate station, you shouldn't simply memorize a set of phrases. It's better to really think about what you're saying to the doctor and get the information right. After completing my year's clinical training, I was able to obtain full registration, but I found it difficult to get an SHO post in my chosen specialty, pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EEA. Once I have completed my second foundation year, I should obtain a CCT, which will allow me to proceed to specialist registration with the GMC, an important step on the road to becoming a pediatric consultant. Thank you very much.